Fibromyalgia. What is it? What causes it? And why would a lawyer talk about fibromyalgia? In 2006, my sister was involved in a relatively minor car crash, which was the starting point for her ultimate diagnosis of fibromyalgia. As a result of her injuries and diagnosis, I've learned a great deal about this condition. Here are a few basic facts about fibromyalgia. It's the most common chronic cause of pain, affecting over 6 million Americans. It is caused by trauma. It affects the nervous system and causes nerve and brain cells to become extra sensitive to pain. This may lead to extra pain signals being generated by the nerves and sent to the brain. Fibromyalgia affects sleep, and sleep disruption may make the condition even worse. There's no blood test, X-ray, or MRI to tell us if someone has fibromyalgia. The diagnosis of fibromyalgia is made by the treating doctor, and they typically do a tender point exam. The American College of Rheumatology says the criteria is 1. A history of chronic, widespread pain for at least 3 months, and 2. Patients must exhibit pain in at least 11 of 18 tender points. So what causes fibromyalgia? Trauma, sleep disturbances, infection, and abnormalities of the nervous system. As I said earlier, my sister developed fibromyalgia after being injured in a car crash. Like her, many of my clients who suffer from this condition were perfectly healthy before being involved in a traumatic event. This trauma is enough to start fibromyalgia in some people. My sister had a prior car accident and recovered quite well from that. But many years later, when she was involved in a second crash, the doctors felt that she would be okay, and with normal treatment and care, she would recover. She had MRIs, X-rays, and blood testing, but unfortunately, as time went by, she developed more and more pain. Now she cannot sleep like before. Small things bother her more. She experiences stress in many different ways that she could have easily handled before. Depression has set in, and suicidal thoughts are common for her. Her medical bills are rising, close to $1 million. She cannot keep a job, and doing the simplest things are very difficult. She has some good days, days where she is active and able to move about, lift, bend, carry things. Then there are other days when she's in constant pain and agony. She cannot function without the help of others. Finally, the doctors realized that she is suffering from fibromyalgia. They started her on a regimen of pain medication. Unfortunately, this has led to drug dependence and constant taking of morphine-type medications such as oxycodone. She's been treated with methadone. They've prescribed Prozac, Xanax, and Cymbalta to help her. Sadly, the doctors don't know what to do or how to help her other than make her as comfortable as possible. The bottom line is this: fibromyalgia is one of the most devastating disease processes caused by trauma. The chronic pain and resulting treatment causes most all patients to be totally disabled and robs them of the simplest pleasures in life. So why would a lawyer be so interested in fibromyalgia? Well, first, my interest is very personal. Having a sister suffer from this horrible, life-altering condition has forever changed my thoughts about fibromyalgia. And secondly, the Florida Supreme Court addressed the scientific validity of fibromyalgia. The highest court in our state has said that fibromyalgia is a real condition and that the treating doctors are fully able to explain the condition to a jury. The Supreme Court went on to cite a stack of medical literature and journals, articles discussing fibromyalgia. And there are tons of articles and scientific journals by top experts in the medical field who agree that fibromyalgia is caused by trauma. But then here's the problem. In Florida, evidence of scientific journals and medical articles and books and medical literature are not admissible in court. Why? Well, the evidence code and the court system in Florida decided several years ago that this type of evidence should stay out of the courtrooms because these articles are hearsay. In other words, unless you bring the author in to testify, you can't just show the articles to the jury. So places like Johns Hopkins and the Mayo Clinic and Journals such as Spine, Rheumatology, and literally hundreds of other prestigious medical schools and journals have all published their findings about traumatically caused fibromyalgia. But at this date, those articles won't be coming into evidence in any trials. This makes it especially difficult to prove these cases since the research on fibromyalgia is still in the early stages compared to many other disease and injury conditions. I hope you found this information helpful. And think about how you or a loved one would feel if they were afflicted with this terrible life-altering condition.